After your surgery, you will be taken to the recovery room where I will meet you because I am the nurse that will be taking care of you. You will be most often awake, although you will not remember the first few moments that you're in the recovery room. I will be taking your blood pressure very frequently, and as time goes on, you will wake up more and more. Eventually, I'll give you something to drink to make sure your stomach is okay and you're not nauseated before you go home. I will go over your discharge instructions and any prescriptions that Dr. Prasad has prescribed. Two dressings that we use most frequently for your surgery are just a cotton ball in your ear or a large cup dressing that looks like a large headphone. If you just have the cotton ball in your ear, you need to change that once a day. You can wash your hair, you can take a shower, even right as soon as you go home from surgery, but you need to have the cotton ball in your ear, and as soon as you're finished, you need to take the wet cotton ball out and put in a dry one. Another thing for after surgery is your stomach may be a little upset. Sometimes that's the anesthesia medication. So for the first 24 hours, we would prefer that you keep your diet kind of light. Soup and crackers, that kind of thing. A day after surgery, you can go back to eating the way you normally would. I mentioned before that with anesthetic medications, we don't want you to drive for the first 24 hours. We don't want you to sign any legal documents, and certainly no alcohol for the first 24 hours after surgery because of the medication we've given you. After surgery, it's very important that you don't change the pressure in your ears. So we don't ever want you to blow your nose until you've seen Dr. Prasad several times in the office, and he'll advise you when it's safe to do that again. We don't want you to stifle or pop your ears or try to do anything that would change the pressure in your ears. If you have to put on your shoes, we want you to bring your shoe up onto your lap. Don't bend over at the waist, because that also changes the pressure in your ears. So if you drop something, you need to use your knees to pick it up. Don't bend over at the waist.